Hi everyone, I am joined by Dr. Ayad Harb, who is a very well respected leading authority in the aesthetics industry, and today we are going to be talking about EndoLift, which is a laser-based skin tightening procedure which Dr. Ayad has now introduced in his Vista clinic in Oxford and will be performing treatments. So really, Dr. Ayad, I wanted to get your thoughts on EndoLift now that you are part of our elite group of EndoLift practitioners. How was your first day and your experience of EndoLift?
Well, I've known about EndoLift for quite a while and have been watching carefully its progress and results, and finally I made the decision to bring it into my clinic here in Vista. And really it hasn't failed to meet my expectations. I knew what it would deliver, and it really has delivered on the patients that we've treated today. I found EndoLift to be actually very surprisingly easy to use, very low maintenance, and very easy for the patients too, which is really important, especially when it's compared to other treatments that I've done in the past. So far, really pleased with the results.
Great. And do you feel, Dr. Ayad, that EndoLift meets an unmet demand in your clinic?
I think certainly, especially within the non-surgical or minimally invasive cohort of patients, which is the majority of my patients. There's only so much that one can do with injectables and fillers and toxins and the skincare before we reach that point where actually those areas that are still lacking, that are not really addressed appropriately with the injectables, they are really crying out for some attention. So especially the lower face, double chin, and the typical areas around the eyes, really there's not much in the way of non-surgical treatments that we can offer until EndoLift comes along.
Absolutely agree. I mean, I would say the same in my practice. All of the areas you've identified are key treatment areas, and actually other treatment modalities really struggle to get the sort of results we're seeing with EndoLift.
That's right.
Dr. Ayad, how have the patients been today? And you tell us what sort of areas we've treated and what sort of results we've been seeing.
So today, deliberately, we brought in a mixture of patients. Some patients have been younger, some older, some with more progressive signs, and some with very early signs. Really just to see the versatility of the device and to see in real life examples, the fact that we can treat younger patients for that more preventative and maintenance aspect, and older patients for corrective and reversal type treatments, and also those patients with heavier faces, with heavy jowls and loose skin, where we're seeing almost instant results on the table. Very impressive indeed.
I'm glad to hear it. So what sort of advice have you been giving to patients about what will happen to their result? Will it continue to improve?
So as with any skin tightening treatment, the result is not now. The fact that we do see an instant result with EndoLift is very encouraging for the patient, and it gets their confidence, but the final result is not yet. There is some patience involved. Early results, I normally advise early results within a few weeks, final results within a few months. So not before 6 months, I would say, before we can judge the final results. And those results can be amplified and built upon using injectable treatments, using skincare and skin tightening treatments like lasers and microneedling to really get a complementary and comprehensive treatment for the whole face.
Dr. Ayad, of the patients we had treated today, can you tell me what sort of side effects they experience? What did they look like after treatment, and what sort of downtime would you expect to see for them?
So normally with these treatments, with these minimally invasive treatments, we do read them the worst case scenario for our patients, with significant swelling, bruising, some downtime, then the fact that they may need to hide away for a while. But actually I've been pleasantly surprised today with EndoLift. Very little in the way of swelling, bruising. Well, bruising can happen with any injection or facial treatment, so that's not really a major consideration or concern. But the main difference that I've seen today is in terms of swelling and that immediacy of results. We've really been able to see visible results, but I can see it, and most importantly, the patient can see it. But they've been able to walk out of clinic without any bandaging, without any dressings, really, and go about their day as normal, with a little bit of swelling, but really very, very presentable, and minimal downtime and very low maintenance kind of aftercare.
Absolutely. And what is the aftercare for patients having endolift?
So generally we advise patients to remember that they've had a treatment. It's easy with endolift especially to almost forget they've had a fairly extensive treatment. So just to be a little bit more conscious of what they're doing, their level of activity, the level of exercise, the kind of environment that they're exposing their bodies to. So no extremes of heat, sun, sauna, that kind of environment. To avoid heavy exercise or the excesses of any strenuous activity, and allow a little bit of time for that natural healing process, which should really only be a matter of days, as long as they give their body a chance for that to happen.
And Dr. Ayad, you said that this would be a very good treatment to combine with other treatment modalities for patients presenting with skin laxity and a loss of elasticity. What sort of treatment protocols would you advise in combination with endolift?
So endolift is primarily focused at the subcutaneous, under the skin level. At the fat, at the connective tissue, at the septi between the different layers of skin. So that's all going to be tightened and reduced and rejuvenated. New collagen is going to be stimulated and fat is going to be reduced. And that's wonderful, but what that leaves is the surface of the skin, which hasn't been treated, and that will certainly benefit from treatments like Profilo, like skin boosting treatments, PRP and microneedling type treatments. And then the other aspect are the areas that are lacking volume, and projection, such as temples and cheekbones and chin, and jawline. If it's a particularly weak jawline, great, then these areas will definitely benefit from injectable treatments like hyaluronic acid fillers, to really amplify that result and really complement the result and maximize the result that you get from the main event, which is endolift.
Absolutely agree, and I would just add to that and say that if you are thinking about doing a combination endolift treatment with dermal fillers, it's best to do the endolift first, so that we're not destroying any of the hyaluronic acid. So you absolutely can do dermal fillers, which I think is in combination with endolift, which is a question a lot of patients ask. But it's the order in which you do it, which is key. And lastly, I wanted to ask you, you also said that you have experience with radiofrequency devices. How do you feel that endolift compares to radiofrequency in terms of downtime, in terms of result, number of sessions, and that sort of thing?
Well, I think it's for me, it's still early days to be able to judge and to have a firm conclusion in terms of a comparison. What I found with radiofrequency treatments is they're very effective, but they do come at a price, and there is a significant downtime related to those treatments because they are really quite powerful treatments. I think, nevertheless, endolift will still have a place because I would see it focusing on specific areas, especially in early stages of aging, around the jowls, around the double chin and malar areas. These areas are sometimes, those quite aggressive treatments with radiofrequency are maybe too aggressive for those very delicate and sensitive areas. So I think immediately I can already see a place for endolift, but in terms of a direct comparison overall, time will tell.
Great, thank you so much.